working their way through our legislature to format it on the Virginia laws. And I guarantee you're not going to see any of these.
We know it's going to be interesting is when
Scenarios play
the
on
Native
Virginia.
Americans wanted their casino, they went to the state, offered them the tax revenue, and the state said, absolutely not, we're not legalizing it. So we missed out on all that revenue. And tomorrow, I believe they
Okay,
vote
we're
on
going to get
medical
started.
marijuana.
Sean will be joining us here in a little bit, and Kristen will not be here tonight. Council meeting follow-up, Mr. City Manager.
Mr. Mayor, members of the council, good evening. I'm not sure that I have anything really to bring up in this part of the agenda
Okay.
that I can recall.
Anybody got anything from last week? No?
Okay.
All right. Move on to the American Legion Memorial, Mr. City Manager.
Thank you, Mr. Mayor. As you have noticed, we have guests from the Legion here locally with regard to a proposal that they would like to have you entertain, which is captured in part by one of the exhibits that you see on the screen, and that is included in your memo in front of you tonight. The basic idea is to move the memorial that's currently located on the side of the highway there along the river, which they'll describe where exactly that is.
Between the St.
First Street,
House and
thank you.
Peppermint.
Been by it on my bike, yes, I have. And to the Zonta Memorial Park over there, if you will, near Fort Casper. And so with that, Mr. Mayor, if I could turn the time over to Mr. Cortez to give us more detail, and of course, questions for the Legion, if there should be any.
Okay.
Mr. Mayor, members of council, we were approached by American Legion a few months ago, and the problem statement, if I had it for you, would be is the current memorial where it sits is just not in a very, in a place where it's very noticeable, visible. It is located just west of the Tate Pump House, and most people won't even know it's there. And so they were looking for a place that was just more visible, but also in a place where people that were disabled, whether it be a veteran or what have you, could kind of view it from a roadway or a parking lot or something of that nature. And so we kind of handed them a few sites that we could come up with within the city that would probably be mutual beneficial to both parties. And this was the site that they liked was Patterson-Zonta Park, which is kind of at the intersection there of 12th and Wyoming Boulevard, kind of just across Wyoming Boulevard from Fort Casper. And so I think there's a, Joe, can you scroll down just a little bit on that? And I think that there's kind of a map that I had included in my memo. But
This one?
Gotcha.
Yep. So 13th Street, so right here would be Wyoming Boulevard. And so you can see from this slide right here, this parking lot's already existing, and so they would put their memorial right here. Me and my staff kind of view it as kind of a nice spot because the geese have kind of taken over this part of the park, and so a little more activity might be kind of nice to maybe keep the geese out of there. And the turf has a hard time getting established right there as well. So kind of the next step for us, should council, we view this as a substantial change to a park that is under your purview, and should council be all right with it, we would work further along with the American Legion to develop something that would more memorialize the roles and responsibilities of the memorial, as well as kind of the nuts and bolts of what would go into the memorial. What I do like about this project is that the American Legion is not asking for anything as far as financial support or any resources other than the property that it would occupy. And so for us, if we could come up with some way to make it so it's lower maintenance for my folks and kind of cut down on that going forward, to us it seems like a pretty good deal. And with that, I would take any questions.
Councilwoman
I'm
Ingram.
just curious of why not the veteran park on 2nd Street?
So we did talk, Mr. Mayor, Councilwoman, we did talk about that spot because it does seem like a ideological fit. One of the issues we have over there is parking or lack thereof. And so to kind of realize that vision of disabled veterans and disabled people to kind of view it kind of from a roadway or a parking lot, it just isn't there. So that was kind of one of the main reasons.
Councilman Neal.
Thank you, Mr. Mayor. So I'm assuming the maintenance and everything thereafter will also be taken care of by the Legion?
Mr. Mayor, Councilman, that's something that we'd still need to work through a little bit in those stuff, but that has been what we have discussed as far as the pavers or whatever they decide to put here, concrete and all that, and then they have Casper College on board to kind of weld up the memorial itself and, you know, donate that part of it, and the painting of that would all fall on them. And then our business would pick up just as you hit the turf, and of course we try to find something that easy to maintain, and then we, you know, do what we would normally do after the memorial. Hopefully I'm answering your question.
Anybody else have any questions? Passing around a mock-up of it right now.
I would just like to say, I think it's about time. This needed to happen a long time ago.
It's nice.
Seems like a no-brainer, eh?
Yep, so we're looking for direction tonight to move forward with it?
Yes, please.
Okay, all right.
That's very nice, actually.
Work to it.
Thank you,
Yeah.
council.
Thank you.
Thanks, gentlemen.
Absolutely.
It'll be a nice addition there.
Yeah.
Good to see you. Hey, everybody.
Be careful there.
Good to meet you, man. Thank you.
Nice to meet you.
My pleasure. Thank you.
Okay, we'll move on to the 6 cent survey, Mr. City Manager.
Thank you, Mr. Mayor, members of the council. As you all are aware, the county helped us take the lead on the survey project that we are hoping to go through with you tonight. On behalf of the question, generally, whether or not a 6 cent dedicated to a capital purpose, if you will, would be appropriate for consideration of among the voters. And following that survey, we've gotten some results now, and we feel pretty good about being able to relay what those results indicate. And as you all will recall, the reason you see a lot of your colleagues from around the county here tonight is because indeed this would be a county-wide question, not relegated only to the city of Casper, which is very, very typical, of course, as it relates to the requirements of the statutes and the process we have to go through for any project that would happen throughout the county as it relates to a 6 cent possibility. And so with that, Mr. Mayor, members of the council, I've asked Fleur to put together a review with you regarding those results. And you know, our hope is that you'll give this some positive consideration, as in, you know, getting ready for the next step, which would include passing a resolution forward to the county commissioners, who would then have the authority to determine whether or not they should advance from the, you know, the local government level to a countywide question, if you will, of this nature. We do have draft resolutions here for you to look at, so you can get a feel for what that formal question would look like. But as I pass these out, I'll go ahead and defer the floor to Ms. Tremel.
Your Honor, members of council, I think you can see my screen. You should be able to see the PowerPoint. Is that right?
Yes.
Awesome. Okay. So as city manager mentioned, we, in February and March of this year, the county used ETC Institute to administer a public opinion survey throughout the county. The goal was to do 500 surveys, and that was exceeded. 773 surveys were turned in. This was a random sampling, and they were done by mail and also online. And the purpose was to gauge feedback, as the manager mentioned, on how people support the 5th cent, and then whether they would be supportive of the 6th cent for the specific purposes which were outlined on the survey. And you all received as attachments in your packet the completed results. So from those results, we had a few major findings. So 90% of respondents felt that the 5th cent tax, which has been around for 47 years, has been beneficial to Natrona County, which is a huge majority. 71% felt they would be very likely or somewhat likely to vote in favor of the 5-cent tax if it were held the day they responded to the survey. And finally, 62% of respondents indicated that they were supportive or somewhat supportive of the reconstruction of Midwest Avenue between Walnut and Poplar Street, which is one of the specific projects which is being proposed for the 6 cent. And then I have a few graphs just to go over with you just to show you the breakdown, since we just told you the likely items. So as you can see, for the whether it's been beneficial, 90% versus 10. The next one, as you can see, if it were held today, this is a 71% is made up of the 55 very likely and 16%, which are somewhat likely to vote in favor of continuing. This would be the 5th cent. And then for Midwest Avenue between Walnut and Poplar Street, 62%, which is once again the 34%, and the 28% were supportive of doing that project. So for historical comparison, I pulled the data from the 2018 survey that we did for the 5th cent survey. And at that time, the question was asked, if the vote was today, would you support the 5th cent? And 73% said that they would. And then after the election, I pulled the results from the election, and the actual vote came up with about 70%. ETC does say that their success rate is within plus or minus 3%. So that's right there within. So, and then city manager also mentioned the next steps. So we believe the next steps would be to have an election on the issue. So in order to do this, council at a regular session would need to pass a resolution, and as he handed out, we have a draft there of what it would look like, and we would pass something like that for Charter County Commissioners to hold a special election to ask voters if they would support a 6 cent tax. And then likewise, 3 other towns and cities would need to do that same resolution or a similar resolution, and then the county would do one themselves. So with that, if there are any other questions or any questions, I'd be happy to answer those now.
Councilmember Paul.
Thank you, Mayor, and thank you, Fleur. I'm looking at the PowerPoint presentation, and on question 8, we asked how supportive would you be of completing the reconstruction of Midwest Avenue between Walnut Street and Poplar Street. I'm wondering, like, was that tied to, like, would you be supportive via enacting a 6 cent tax, or is it, would you be supportive of it generally? Because I feel like those are 2 different questions. So I'm wondering if we tie that into that 6 cent somewhere?
Sure, Your Honor. Yes, it was specifically with 6 cent. Okay. Whether they would be supportive of it, of a 6 cent tax for this purpose.
Okay, thank you.
Yep.
Councilmember Nell.
Thank you, Mayor. Do we, I notice this is going to require, I'm assuming, bar none, Evansville and Mills in order for this to fly. Have we gotten any feedback from any of those municipalities as to where their thoughts are? Are we going to be the pioneer here? I mean, what's the deal?
Mr. Mayor, Councilman, you know, we certainly have been visiting about this, as I mentioned, as spearheaded by the commissioners, as a group that would include all the towns in the county, including the ones you just mentioned. You know, to date, they've been very supportive of this concept and this idea, and as a matter of fact, they had a hand in generating the list that we would actually take forward to the community, the larger community, to inquire of their interest to fund these projects. And so whether or not their voters and so forth would agree at the end of the day is yet to be known, aside from the countywide survey that we conducted to hopefully give us a feel for how that would look. So I'm not sure if that totally answers the question.
It does to a point, but additionally I would ask, what happens if the state enacts a 6 cent? We get into revenue issues and they throw, what's that going to do with this? Is that going to put us up to 7? Is it?
Mr. Mayor, Councilman, it depends on how that legislation would ultimately be passed. As you know, and as we've seen over the years, drafts of these kinds of ideas have come forward in a conversation from time to time, and even with respect to that particular legislative discussion, the bill that comes forward for the House and the Senate to vote on oftentimes looks quite a bit different than what the original idea that was originally posited. So to say specifically, I couldn't say, but the reality is that if the state did pass a permanent 5th cent, for example, this indeed would be in addition to that particular creation, whatever that might be.
Councilmember Pollock.
As far as I can tell, this looks like preliminarily very positive, so I think it's worth pursuing, putting the question out. I think that it's very likely that we could have this all said and done before the state raised sales tax by 1%. So I don't think we need to get too concerned about that, because I don't see that happening anytime soon. And you know, the beauty of this tax, if I understand it correctly, is that once this project is done, it goes away, and we've accomplished what we set out to accomplish. I think this shows at least 62% of people have driven Midwest between Walnut and Poplar Street and have experienced it firsthand, because I don't think there's any room for disagreement that this project needs to be done, and it looks like a preliminary show of support from citizens. So if we can get it done that way, I say let's get it done.
Councilman Cap.
I agree that it needs to be done. My biggest concern is we're coming up on a renewal of the 5th cent next year. Okay? Also, along with that, if you have a special election, we do not get a turnout in special elections. And all you will get on a special election, if you try to hold that between now and say November, is you're going to get the no taxers to come out. And so this 6 cent will go down to defeat. If you have the election during a normal election period, you will get a much better turnout and much better support. And I use, well, the last special election we had was for smoking. There were less than 7,000 people voted in that election. It was 2/3 to 1/3 nay. We had more than 7,000 people vote in my ward in the last general election. So that shows you kind of where that breakdown comes. And I am concerned that if we try to go out to a special election, particularly before we take care of getting the 5th cent, we will not only will the 6 cent go down to defeat, but I think it could potentially jeopardize the 5th cent. Those are my concerns in the bigger picture. I agree that we need to figure out ways of funding these projects, and a 6 cent would be very good. I just don't know about the timing and how the rest of the people will vote for it. And particularly when a portion of the town feels like we've spent enough money in OYD already. Just, those are my concerns about trying to get it through.
Could I, Mr. Mayor? Thank you, Mr. Mayor. Councilman Cathy bring up some good points, and certainly the group, which includes the mayors from around the county and the commissioners, had conversations along the lines of just exactly what you're discussing. And so with that, I think the timing of the election certainly needs to be discussed, and the commissioners obviously have that decision to make as well. The reason that a special election was proposed, despite the fact that indeed it does have its weaknesses, as you correctly identified, in terms of attracting a full scope of attention from our voters, if you will, is that if the election were held in timely enough of a manner to be concluded, that tax could very well be done and over with by the time the 5th cent tax is brought forward to the voting public, which would be in November of 22. And so timing is a pretty critical element that that we would need to discuss as well, because what I think should happen at least, and what I would advocate to you for and to the commissioners for, would be that of conducting the special election, say in August, in order to get it initiated, get the gathering of those dollars, the corresponding dollars, done in time for that next election to occur and effectively be out of the way, so that the two issues are not head-to-head in November with regard to kind of a bifurcated request that would come in front of the voters. And so my proposal would be to all of you, as well as to our fellow commissioners, is that of conducting that election soon enough to where those critical elements can be done and taken care of, and then we can deal with a clean slate as it relates to the 5th cent coming up in November.
Councilwoman Ingbridge.
I need some explanation about Midwest and Edgerton, because I personally am having a little bit of trouble just wrapping my head around city of Casper, Barna, and Mills, and I understand it's all part of the county putting in water lines for Edgerton.
Mr. Mayor, Councilwoman, I would probably be best to defer that question to our friends from that part of the county. Commissioner Bertolio, I know you know a lot about it too, so I'd defer to whomever would like to tackle that question.
As far as putting the water lines in for Edgerton and Midwest, the water line is there, and it's been there for some time. What we do is, we have some bad soil out there where that water line lays, and it virtually eats holes in that line, and I don't mean pinholes, I mean holes. It costs, for us to fix a water line leak out there, it costs us anywhere from $10,000 to $15,000, right, Jamie?
That's probably fair for water loss costs, contractor.
Yeah. Costs us $10,000 to $15,000 to fix it out there. And we have got people out there, like we've got FDL oil field out there right now. They do a lot of fracking, they use a lot of water. They bring a lot of water, a lot of money into this town. Used to be, when we had Amoco and Anadarko out there, we had a lot of people that worked for Anadarko and Amoco when they lived in the area. Right now, I think there's only about, between the two towns that actually work for the oil company out there, it's probably 4 or 5 at the most. Everybody else gets paid on payday and drives their white pickups from FDL back into Casper and spreads it out amongst you folks. We don't see that. So you're not, it's not the idea that just because there's, what, about 800 people out there. We have to have water. You don't have towns without water. And you don't have businesses without water. Your oil field out there, I would have to just spool it up and go home because they wouldn't have any water. Oil and water do mix in certain situations, and this is one of them. Anything to add to that, Jamie?
I don't. I'm Jamie Jones. Mayor Chapman's out of town on business today, so I'll be fill-in. Slim pickings. There's only 3 of us, so here we are. In respect to what Mayor King had spoke about, the pipeline was built in 1997. We followed the original right-of-way from the 20s up continuously. Tate Pump House came up in conversation earlier. That was the original Midwest Pump House up until the early 90s. And then it started getting decommissioned. Built a new structure in 97 out there, maybe at Westman's Road, just spread off I-25. So the water is purchased from Central Wyoming Regional Water System and piped out there. Prior to that, we had numerous feasibility studies for water locations, whether it was on Pine Ridge, whether it was on Tisdale Mountain. There was no the best option was to continue drawing from the North Platte River using our water rights. We relinquished those over to Central Wyoming Regional Water System in order to have the water to provide for the two communities. As Mayor King said, the soil is what they call hot. There's a bunch of contaminants in that soil. Also limits us to what pipe we can put in the ground, what kind of gasket material we can use. That drives the cost of that lineup. What we're asking for is 7 miles of pipe. We're not asking for 40. We're asking for the final 7 miles that traverses through the Salt Creek oil field where that soil is no good, where it is rough. And he's not kidding about the hole size. We're talking 50 cents or larger, 50-cent pieces or larger. Often they'll start out a nickel and dime. We may not catch that. That water just goes away. We still pay the cost for the water. We still pay the cost to pump the water, because that's what we have to do until that leak surfaces. And by that time, it's a gaper. It's a big one. So with that being said, I second his comments about the communities needing water to survive. That's kind of a given with anywhere. We certainly can see the concern of the other communities in the county paying for a project that benefits only 800 people, only a large oil company, only a school. We get that all the time, not only from people from elected official position, but clear down to the public that stops at the convenience store and starts asking questions. We do get that, but there's also many projects in here that we still spend our tax dollars. We come here for groceries, we come here for entertainment, we come here for a meal out. We put in as much as everybody individually puts in as well. You know, that 1 cent, you take 1% of somebody's salary, and if all that was spent in Natrona County, which basically, again, it is not, but it's a minute amount to invest to make sure that we've got for another 25, 30 years a solid water source coming to the communities out north.
That's Mayor Pacheco.
Thank you, Mayor. Yeah, I wasn't going to intend to go this way, but I think we need to stop looking at ourselves as individual municipalities in some sense. When we're looking at ourselves as a whole county, we're looking at how we can and be good neighbors to Midwest and Edgerton. I know Buck's been talking about this for a lot of years, and even when I was mayor, he had been struggling with that pipeline. I think it's a good thing to do when we look at going after this 6 cent, and I think it's important. We're not getting much help from the state to figure out how we need to pay for things, and so I think the municipalities are going to have to start working together and start figuring out how to do these things, because I don't think the future looks very bright for us from the state. So this is going to have to be some ways that we generate revenue, figuring how do we do that and start working together as a community, as a county. I think that's going to be critical, and so I'm 100% behind this. I think there's support for it. I like what the manager has said about how we strategically place this and do that. I do hear Steve's concerns about that, and I do share those concerns that could be a small turnout in an election, because we've been there, we've done that. But I think we've got to take that chance, and we certainly don't want it to buttress up against the 1 cent come election. That's pretty critical for all of us too. So I'm behind it. I just want to reiterate, we need to be good neighbors, and we need to help out how we can. So 800, we need to be there for them. So
Councilman Nell.
Thank you, Mayor. Me personally, I don't care if there's 2 of you out there or 800. You're county residents and you're entitled to everything we are, in my opinion. So I don't look at you any less than I do myself or my neighbor. I'm not a tax guy. I don't like taxes. I don't like people having to pay more money. But in a situation like this, when we're going to turn it to the voters and they get to make that decision, I'm 100% on board. Let's let them decide, and then, I mean, that's a no-brainer for me, because people don't want taxes. Some people understand the need for them and that we have to do things, but it's never a win when you're spending tax dollars. But if we can put it out to the voter and get them to decide, win-win.
Councilman Casper.
Councilman Pacheco brought up a good point as well, and that was what I wanted to bring up, is basically the outlying communities will wind up in essence with the same percentage of a 6 cent as they do of the 5th cent. And they don't tell us how to spend our portion of it, and we shouldn't be telling them how to spend their portion of it. They know what their needs are, and they need to then go along with that, and we need to be supportive of those things. So I think that is a very appropriate thing from that standpoint. The second part of it is back to my initial concerns, is I look back as well at the way the county looked at the Hall of Justice expansion and rebuild, and if this were to be defeated this August, when we turn around in 22 and try to bring through the 5th cent, are they going to be hesitant then, thinking that, well, you're just going to go blow that money on Midwest expansion, and that then hurts the chances again of the 5th cent being approved. Those are my concerns, is I do not want to lose the 5th cent. Now, by the same token, by a county-wide vote, the 5th cent can be made permanent any time if we were to so choose. Those are my concerns, and that is something that we have never chose to do, but by vote of the county, the 5th cent can become permanent. Just bringing up historical things that some of us I know have not been around for or forgot about.
So it looks like the election, if it's held, will be in November, not in August of this year.
The special election.
Yeah.
So there'd be a year between the special election and the.
This, yes.
Oh, absolutely. 22.
Am I to assume you're looking for direction from us then to forward this on to the commissioners or forward it on to council during a regular session?
Good one. Go ahead. Mr. City Manager.
Thank you, Mr. Mayor. Basically, what we need at this point in time is the blessing from all of you to move a resolution forward for your formal consideration on the floor. And we would expect that we could hopefully do that by the 18th of May. And I would hope that as a part of the resolution, if it's not already in there, suggest the time frame by which the special election should occur. And I would say that as far as the overall strategy is concerned with respect to the 5th cent, this August would be as ideal as I can imagine. But without a doubt, your feedback in that regard, and the commissioners obviously need to weigh in on that as they decide these kinds of things, would weigh very heavily in how that all works.
Well, you certainly have mine.
If I can get a couple clarifying points, so from Eric Nelson, the county attorney.
Thank you, Mr. Mayor, members of council. My name is Eric Nelson, the county attorney, and I just want to make sure we're all on the same page. So with regard to a 6 cent special use tax, that's governed by 3915-203, Romanet 3, and so it has to be held in November, so November 2nd, and 110 days notification has to be given to the clerk. It's held very similarly to a bond election. So July 15th is the drop dead date that resolution would be required to be transmitted to county clerk Good. Now, we talked about a resolution. Because this is a special use 6 cent tax, it is project specific. So if, for instance, Midwest is a project on there, there can be other projects, and you're not limited. And the way this has been done in other counties, it can be an all or nothing proposition, it can be a menu. You can ask the voters to vote for one and not the other, however it is agreed upon. But in that resolution, all of that has to be agreed upon by 4 of the 6 municipalities and the county. So when we talk about a resolution, we can't have various iterations of it being approved by the different municipalities. We all have to agree on one resolution that addresses the language on the ballot, how much is going to be requested, and then if there's excess funds that are collected, how are those going to be dispersed? Are those going to be pro rata returned to the municipalities, to the county, or there's some language that allows it to be put into kind of a sinking fund for maintenance. So there's a lot of different moving parts, but I just want to make sure we're all clear on kind of what we're talking about in terms of timeline and what would need to be approved by the majority.
Thank you. Councilman Gett.
A question for the county attorney there. So where this just lists the Midwest Avenue, Walnut Street here, this resolution would need to include the Midwest Pipeline, whatever Mills wants and everything else in here.
Yeah, Mr. Mayor, Councilman, I think what I would like to see, and what they've done in Teton County, is that all of the entities approve the same resolution. So it would have to have all of the projects in there. It would have to,
Okay.
talk about the dates, and that's something that, outside of the work session, if this moves forward, that the group can get together and we can work through those details.
That's what I was wanting to find out. Okay. Thank you.
Any other questions? Councilman Gamble.
Thank you, Mayor. Well, hearing Eric Nelson speak about the potential for, having voters choose which ones they'd like and stuff, and taking into consideration Councilman Cathy's concerns about, putting this up to the voters, being shot down, and then having a tougher time with the consent the following year. I am curious, did we receive the full survey results? I see in the summary we have questions 1, 3, and 8. Did we get the full copy, just out of curiosity? Because I'm kind of curious to know. I don't see like a, over here it says survey indicated majority of residents supportive of the water line, but I don't see it in our summary, so just always looking for more information. Thank you.
Mr. Mayor, Councilman, I'm going to ask Fleur to weigh in on this, but I thought we did put out the full context of the survey.
It should have been in the packet, but we will send it all to you all again. I'll send it right now.
Thank you.
Yep. Vice Mayor Pacheco.
Just kind of what Eric was saying, making sure that the reso has all the stuff in there, kind of looking over that. It does have, to me, it seems like it has all the information. I don't know if you've looked over it yet, Eric, I'm sure you have, but it would seem that it's got the information that we need in there. So I don't know if you've looked over it yet.
I have now.
Okay, good.
So.
Yeah.
So as far as direction on this, direction of working with the other municipalities, the other entities to put together a resolution of what projects we want to put on the ballot and making sure that that is brought forward to us in time to get to you.
Yes, sir.
Councilman Nell.
Would we not have better success at this by packaging the whole thing and not itemizing this and letting them pick and choose?
Yeah, that's what I was just saying.
Oh, that's what I was asking, if that's what you were saying. I'm looking for clarification.
Yeah. So picking the projects that would go on this, not.
But then the
a list
voters
that
don't
they-
get to pick each one. It's just a, okay, that's what I was asking. Thank you.
Yeah, that's what I was going to say, is I think it needs to be an all or nothing, otherwise
Absolutely.
I could see
Certainly does.
Casper voting for Caspers, but
Yeah.
not
Correct,
voting for
and that
Midwest.
was why I,
But they'll see what
That's
they're
exactly
voting
right.
for and what projects are gonna get done with that
which is
money.
fine.
But not pick and choose.
Right,
Yeah.
thank you.
Okay.
All right, so that's our direction moving forward. Are we good with that?
Yes.
Yeah.
All right. Anything else?
No, thank you, Mr. Mayor, and thank you to everybody that came tonight. We appreciate having you here. Thank you very much. Good to see you.
Okay, we'll move on to the Health Department budget request. Mr. City Manager.
Mayor, could I don't know why I didn't realize this when we talked about this last time, but perhaps it's because I haven't worked for Ms. Kinder, but I have worked for the health department in the recent past, and so spoke with John and decided it's probably best if I abstain from this conversation.
Okay, yep.
Maybe, so, out there, I guess?
Your choice.
Public
Go
health.
in there and eat snacks.
Public health.
Yep.
Kyle,
Kitchen make
just go in there and eat snacks.
Yeah, there's, Kyle, in the very back corner, there's a seat back there.
Always open.
I just couldn't resist.
have her presentation.
Oh, gosh. Stan is falling down on the job. I'm good.
Okay, move on to the Health Department budget request. Mr. City Manager.
Thank you, Mr. Mayor. With respect to council's request of Ms. Kinder to come back and visit, we have a part 2 of the Health Department budget request that Ms. Kinder will lead us through. If I may defer the floor to her, Mr. Mayor.
Okay, Ms. Kinder.
Thank you. Thank you for the opportunity to come back to you and talk with you today. I learned a tremendous amount, and hopefully you have the opportunity to learn a little bit more about the health department. So I know there's a lot of slides here, so I'm just going to hit some of the higher points, but add a couple points as we go. So if we were to define public health, it's what promotes and protects the health of people in the communities where they live, learn, work, and play. While a doctor treats people who are sick, those working in public health try to prevent people from getting sick or injured in the first place. Public health supports the belief that everyone should have a fair and just opportunity to achieve good health and well-being. So this year has definitely proven to us that we are connected in more ways than just in the health aspect. Whether we like to admit it or not, we've been involved in the economy, education, social support systems, etc. So, as you'll see, I did make a typo. My apologies. I have corrected it. It is fiscal year 2022. I know that you received some information in regards to that in an email this morning, so I just wanted to clarify. Numerous people looked at this presentation for you all, and it just was one of those things that kept getting missed, but we did correct it for you. Just to point out, this was kind of interesting for us to look at the funding stream that we receive with and without COVID funds. Obviously, we get a substantial amount of COVID funds through the Wyoming Department of Health, but we broke it down just to kind of show the different pies that exist. So city funding is your darker color, the county is the darker green. And this is where we pulled up the history, so we made it all the way back to fiscal year 15, looking at where we are at. So in fiscal year 2015, the city provided $600,000, and this county provided $650,000. And then if you scroll over those, it does break it down. If you need me to, I can tell you the exact amounts on each one of those years. We always try to secure as much grant funding that we can from revenue and then fee for service. As you can see, over time since 2015, they continue to decline as well. This slide talks about, you can see the extensive support that we also receive from the county, besides the monetary. We utilize all of these services under the county support. We also have grant funds, and I know that there were some questions about grant funding. When we receive a grant, for example, the COVID testing funds, it can only be used for COVID testing. We cannot move that to any other category, shift anything. Same with community prevention, MCH. Everything has to keep within itself. Hence the reason why we have 31 different budgets that we keep track of. You can't look click your fingers to turn the page like you once used to be able to. I know employees was a big question. We do have almost 100 employees. However, only 22 employees at the health department are actually funded by city and county funds. We have a total of 47 full-time employees that work at the health department routinely all the time. 25 of those are paid from state and federal funds. And then we have 45 COVID responders. So that's where we get to that bigger number. But only 22 of those are paid through by city and county funds. To save funding, that bottom line, we have 9 unfilled positions, which means we do more work for less money. So we have no intention, obviously it would be nice, but we know that there is a certain level that we can go to as far as we can't hire additional nurses, clerical, those kinds of things, as much as we would like to, but that also prevents us from expansion. When we look at reimbursement fees, this is where we try to get as much as we can from other sources to always try to build in that area. And then special considerations of having the grant funding, we bring those to us on purpose so that we can get some of the indirect funds. Like for example, a grant will give us 8% to run or administer a grant. We use that to put in our administration funding so that we can make sure everything moves forward. But we cost share and we also reduce costs by bringing as much to us as we can otherwise in addition to city and county funding. We looked at 3 different years, so in the year of 2018 through 19. You can see that Casper, we served 81% of the population, broken out with Mills, Barnum, Evansville, Midwest, and outside of Natrona County. So you can see a vast majority of the services that we provide are in Casper. We looked at everything from our clinic, our adult health, trainings, all of the clinic things, maternal child health, etc. So we have total clients. So when we look at this number right here, the 4,671, that's how many single visits a person will come in and receive services. However, they can come in multiple times for different areas. So if we have a mother who comes in for maternal child health services, she may also access other parts of the department. So that's why we have total clients and then the grand total of multiple visits. They may come in for STDs, but these are unique individuals that we serve in the population. This is 2019 through 20, again 83% for the city. And this year through March, we don't have all of the information in for April as of yet, but we were able to pull what we were looking at just through this time. So you've actually seen that we've seen an increase in the number of people that we've served in this year. Some of that is probably due to the COVID testing, vaccination, those kinds of things. So the items that are in red, and I'm not sure how you access the information, these are the ones that we're asking for support from the city to come in and help provide funding for. The first one is an administration, which basically supports all of the things that we try to make sure we cost share across the department. So we will pay for all of the maintenance of the cars out of administration, but it's not like if something goes wrong with one of the maternal child health cars, it doesn't come out of that department, it's actually through administration. So we try to absorb as much as we can. There's 31 separate budgets that we track and maintain. And we also review all the deliverables for all the grants and make sure that everything is within line and meeting our deliverables. We are federally single audit compliant. We have had no significant issues with those. And we also follow along with the staff training that was required. The county health officers, we are required to have one of those. We actually have one main county health officer with 2 deputies that work under him. These are individuals that watch the community trends, see what's going on, provide guidance, assistance, making sure that we are paying attention to what issues could come along that would be putting Natrona County at risk. Adult health, again, this is the one that has the LT 101 and the community-based waiver. We're really evaluating this one to see what additional we can figure out for this. The funding is very limited and very short on this. There's been huge Medicaid, Medicare cuts. So we're still evaluating this. This will be something that we'll work all the way through July to figure out what is the best for Natrona County to provide the services that they need to. We also have the Board of Health, which I have 3 board members here with me tonight. I have Christine Nelson, who's a pharmacist at Wyoming Medical Center. I have Tia Hansold, who's a nurse practitioner who works in multiple communities, but also has worked at the health department and has the knowledge of how we used to do things and what not to do if we want to try to learn from past things. And then I have Mike Meadow, who is our chair, and then Christy is the vice chair. City of Casper, we pay the Board of Health. A lot of that is like funding for meetings or trainings that they need to go and do. Disease prevention, the only part of the clinic that we're asking for city funding is for the immunization, which we know a lot of back to school vaccinations, flu clinics, all of the required vaccines that we need to have to make sure people are able to attend school or travel, which you'll see yellow fever, typhoid. We do the rabies vaccine in the community. And we're a very trusted source for the community to make sure that the vaccines are where they need to be. And we do massive vaccine clinics. Environmental health is also state mandated, and there's some key points here. But what I wanted to draw attention to was that the majority of what you see are pools, restaurants. There's 408 restaurants in Casper that they inspect on a routine basis. Pools are up there at 75, as well as child care facilities that they have to go in and make sure are doing what they need to from the federal and state level. We also have the health department building. We had an increase in utilities and cleaning. Health department building is, we've lost a few parking spots this last week. The city has done some work down there, but it's all good. It's going to be nice. We'll see how it goes. So getting to our office right now is a little on the crazy side, but we're adaptable and we're very resourceful how we get to work. But we also have the ability that number of places will come to us. So we have the endocrine clinic that will come in and provide services, a service that is not offered anywhere else in the community. We often bring people in so that they can receive services there instead of traveling to Denver, etc. Maternal child health. This is the one program that is sustaining the biggest hits. Again, if you'll remember before, I talked about the 75% and the 90% provides education to those through age 2. This bottom, there's a new curriculum. How often we are required to see with the curriculum as well as the mandated needs for seeing each person. So you'll know that a couplet, which is referred to mom and baby, is seeing 20 to 25 visits in 1 year for up to 1 to 3 hours. So that's 60 hours for a couplet for one nurse who can see 35 couplets in a normal year. We have 3.5 nurses, and so we're currently able to see 122 couplets per year, yet mandated to see over 600. So it doesn't work out, so fantastic, and that is one of the programs that has taken the biggest hit. I just provided other information for you as a reference. Like I said before, we have the community prevention program that receives funds, COVID testing, COVID vaccine, disease prevention clinic. This is where you get your TB, latent TB, immigration, physicals, travel. We do lice checks quite often and watch epidemiological trends that we see in the community for vaccine preventable diseases. We have family planning, Title 10. We do evaluation of STDs. And we have emergency preparedness, which looks at always making sure our community is prepared for whatever may come its way, and then some. And then we have the expedition program, and you can see all the different places that they go and do education as well as testing. We have HIV case management, which we serve almost 40 individuals. This is a program to keep them safe as well as navigating the healthcare systems. and TANF, which is Temporary Assistance for Needy Families, which is part of MCH, which is funded federally. And then the Wyoming Education and Training Center, which is funded by the University of Washington. And Wyoming Cancer Resource Services, which we actually help provide assistance for people to get mammograms, different things like that by funding through the state. And then the Wyoming Cancer Coalition. So I know that was fast, but I know that you've had the information for a while. I wanted to make sure that there were plenty of time for any questions or comments that you may have. I can talk fast, and sometimes I have to slow down and remember to breathe. But I'm welcoming anything that you may have to ask or more information that you would like to have.
Any questions from anyone? Councilman Catt.
I guess the one thing that concerns me is you mentioned expanding programs. I realize people have lived here longer than I have, but I've been here 30 years, and basically we're the same population we were back in '91, plus or minus a few thousand. But I guess I am concerned about government programs continuing to expand and basically grow government and build empires. My wife worked next door to Women, Infant, and Children program. Their whole goal wasn't to teach people how to survive on their own, it was to get more people signed up. And I have real issues with continuing to grow government programs. You know, we have, what is it, True Care here. You have Planned Parenthood. Why aren't people going to some of these programs that are basically free to them the same as yours are, rather than going to them? And those are all privately funded. Well, Planned Parenthood isn't, but True Care is. It concerns me, the growing of government.
Okay. I can respect that question, and I think Tina, you.
I definitely respect that. Last year in the spring, the board was getting ready to start some strategic plan. Can't understand me. Strategic planning, and of course COVID hit, and you know everything kind of went by the wayside. We're getting ready to do that again, and the significant thing about public health is it changes all the time. That is what public health is, looking at the needs of the community, not what we want to do, not what we want to do when we grow up kind of thing. It's what are the needs. And one of the goals in that planning is we don't necessarily need to reproduce what's already out there, and that's part of strategic planning. It does change all the time. Planned Parenthood no longer exists in Casper. They actually send all their clients to us. Most of the programs I would say our philosophy is not to, I don't like to use the word free, no charge for clients. I mean, there's a few that there are no charge, but a lot of them we encourage fees. We try to get fees. I think that makes the people a little more responsible. Our maternal child programs, they do try to teach independence. But I know what you're talking about, because there's a lot of programs out there like that. But that's the board's job to make sure, you know, it's not being duplicated. We're getting the funding we can out of people. Again, trying to keep the community healthy. And it changes every year.
And I agree, there are needs that aren't currently met in this county with private places. For example, the opioid epidemic. There's so much work we can do in that. Child smoking and vaping, there's a lot of work that needs to be done in that. You know, I think we'd like to expand more into those arenas that aren't currently offered. You know.
And I think when I said expansion, there's opportunities that exist out there, but it's not something that we're looking at doing now. We want to do the work that we have placed in front of us and do an exceptional, optimal job with that. There are services that are being dropped by other people in the community that are essential to making the citizens in Trona County safe. So that would be where public health would come in. We're providing services that no one else does. So we're guided by the state and the federal government to provide those things. Public health has existed forever. Immunizations is something that we do that is just a requirement. STDs, all those kinds of things. We make it accessible for individuals to be able to go and get the services that they need. But it's not a duplication. We're not in competition with anybody. Planned Parenthood and True Care, they provide very different services than we do. We know where the mom is at. We know what she, may or may not need, plus minus from preconception all the way through age 2. Then it taps into some other services that we have at the health department. So always making sure that the patient is taken care of first and foremost, and what services do they need. We bring the services to where they're at.
And a lot of it is preventative, to try to prevent in the future costs that are associated with having these diseases and having these, issues that we can help prevent.
Absolutely.
Vice Mayor Pacheco.
Yeah, so the way I guess I would respond to Steve's concern is, for me, it's obviously, nobody likes government growing, and people want government as especially here in Wyoming. But the way I kind of equated it is in 1991, there was a lot of different things. The landscape is much different for our young people. Landscape is much different for single mothers. Landscape is much different. And I equate that to the same way that police are. Back in 1991, we really didn't even have body cams. We were in need of body cams. That's an expansion of government. It had to happen. And I think in the same sense with public health, it's going to happen. It has to happen in the sense of what we're trying to do to reach certain people that need that help. And so there's going to always be some level of expansion in government, whether we like that or not. And how do we figure that out and do that in the best case that we can? The way I see public health is a need, and there are a lot of people that cannot afford health. And to me, whether you believe it or not, health is a right. And so everybody has that, to have the ability to have some type of access for their health. And how do we do those things? We try to offer that as best we can. And I don't think we can go back to 1991 and then say, oh, well, and it's completely the same thing. The landscape, we weren't dealing with, look how we were dealing with HIV in 1991 versus how we deal with HIV today, 30 years later. So for me, that's how I would answer that question, in the sense of there's always going to be that level of expansion. How do we do it with the best case way? It's difficult, and I understand. So I understand Steve's concern, though. I hear what he's saying.
I've been in public health a long time and on the board a while. And all the years we spent training for emergency preparedness and the money we get and the things we do, and I'm always thinking, I wonder if we'll ever use this. I wonder if we'll ever use this. We kind of did. But, COVID hit, and we did a pretty good job. We didn't do perfect. And, everybody has a different opinion of how we did. But in general, we were ready to do a good job. And that's from all the training we did over the years in thinking, and that was a lot of federal money, but could we be doing other things for prevention instead of emergency preparedness? I remember thinking that, will we ever have an emergency? Well, we did, and I think we were ready, and we had a lot of training to do what we were able to do this year. I hope we never have to do it again. But we'll probably have to keep training.
And I have two questions for you. So on one of the slides you talked about outside county services. Who would that be?
So on which part are you referencing?
One of the slides up there, you were talking about, it was a breakdown across the board.
It was the slide with Casper and Mills and
so the other counties or the other places that we provide services.
Right.
So we do have some. So for example, Wyoming Cancer Resource Services serves 4 counties. So it's Natrona, Crook, Carbon, and Niobrara. So we provide that. Wyoming AIDS Education and Training Center is a statewide program. So essentially, like those grant programs that are self-funded, there's no city or county funding that goes into that. They are very specific to their deliverable area. So that is, So with this, is that what you're referring to?
So that last column there, you're saying that is grant funded, that's taken care of.
And some of those, like for example, HIV case management, we do provide services to people outside of Natrona County. We have people that travel here to Natrona for services because their community doesn't have what they need to have. So that's why they're counted as that outside entity.
Okay, so So follow up to that, so being that that's covered by grant funding, the rest of the agencies that are at the communities up there, we put in, the county puts in, does Mills, Barnum, Evansville, Midwest, do they put any, do they have any skin in the game?
No, we have not done that, to my knowledge or to, where I'm at in my time.
Anybody else have any other questions?
This one.
Councilman, no.
But on that same line of thinking, why would it be up to the constituents in Natrona County to take care of Mills and Edgerton and Evansville and Walnut? Huh? But that's,
So are we.
it's Casper money that's going in. Why aren't they participating, I guess is what I'm asking. Why has no one gone to them and said, we're taking care of you, you need to pony up just like everybody else is? I guess I'm curious. I think that's a fair question.
Commissioner Vertaglia.
Thank you. Thank you, Your Honor. Members of the council, the county health department is under state statute, so first-class cities can opt to join the county health or district. So back in 1954, the city of Casper opted to join with the Natrona County Health District. It says nothing about small towns. It only addresses first-class cities. So that is why the county basically is in charge of providing for those that are outside of first-class cities. Now, the question remains, Mills now is an interesting one because technically, as a first-class city, they, by resolution, need to make the decision whether they want to join this consortium or not. And it's something that, I mean, I've been looking at it. It's kind of interesting because it says first-class cities may join, but it almost at the same time is implying first-class cities have to have a health department. So it's Eric and I have both been reading it. Nowhere do we find where it says first-class cities have to have one, but it certainly implies that you're supposed to have one if you don't join a health district. You could have a health district that is us and Johnson County or whatever. You can combine counties, you can do all these things. So it's probably something nobody's looked at in quite a while. But I was curious the last day or two on this. You know, we all the facilities the county or the city operates, Metro Control, Public Safety Communication Center, everybody pays a proportionate share. But in this particular case, that's kind of gone by the wayside where it's either us, well, it's us right now, the city and the county. And, you know, at the jail, there's a straight payment based on who books you into the jail. There's a charge back. So it's something I would ask you to consider that as you look at these slides, that the county health is really taking care of a lot of stuff that probably the city, if it were independent, would have to pay for themselves. So. But Eric can probably go more into the statutes.
So, Mr. Mayor, not to dive too deeply, but so 1954 is when the Casper and Natrona County Health Department was established, and that came about through a request by the city of Casper to the county to hold a special election. So it was actually the residents of Natrona County at the time elected to establish this health department. And by statute, the health department has jurisdiction throughout the county and all municipalities that are not first-class cities and any first-class cities essentially that opt in, which obviously Casper has. And it's not quite that clear, but that's kind of, I think, a fair reading of it. Obviously, with Mills now exceeding that population threshold, it becomes a little bit more of a nebulous situation as to what the jurisdiction of the health department in Mills is, whether they need to really opt in or not. I pulled some old county attorney opinions back from the 80s, and that issue is kind of sidestepped because at the time there were no other first-class cities. So it has, the landscape has changed, and I think it's a fair issue to inquire about. Certainly as Mills' population grows and their residents will presumably have more and more of the load in terms of seeking services, and it probably does make sense to approach them for some funding. Very unique statutes with regard to the way the the health department is funded. Just a little bit of background. So back in the 1980s, there was some litigation between the health department, the city of Casper, and Natrona County, actually. There was a resolution, and so by statute, a treasurer out of the city or county has to keep a separate account for the health department. So our county treasurer now handles that, and so by statute every year, the health department then is required to come before the city and the county with basically their budget request, information on any kind of surplus they have, and the way that the statute reads is that the city and county will then fund that request above those reserves. Obviously, that doesn't mean that it's an open checkbook, right? So there is some lack of clarity in the statute, but it's an interesting, I guess, statutory creation outside board that the health department is, and obviously we're taking a harder look at all of this in light of what we've gone through the last year.
I guess just to clarify, the reason I asked those two questions is, first of all, when we're making a decision as far as spending money for the county, I wanted to verify that anything outside the county is not, that's not where the money's going to.
Right.
So that was the first part. The second part of it is, in my personal opinion, when you take a step to go become a first-class city, because we knew that that's what happened, when you take a step to do that, there, along with that comes responsibility. And so I guess that's, to clarify, that's why I was asking that. So, Councilman Kevin.
I'm playing the devil's advocate. I do not advocate this position at all. I want everybody to understand that. But based on what you just said and the way the statute is actually written, we could actually vote to opt back out of it and dump the whole thing onto the county.
Maybe.
And I'm not, like I said, I'm not advocating that, but I'm trying to understand the ordinance and that part of it.
Yeah, I think that's a fair question. So there's a specific statute on dissolution of a health department or health district, and the way it reads is that it can be dissolved through a resolution passed by both entities. So that when you read it strictly, you can kind of say that, well, both entities have to agree to dissolve it. And so then the question, I think it's an open question, whether one entity could back out. And I would guess that that would be the subject of litigation and the court would have to decide. But it's not clear in my reading of the statute how that would work, but I see the question.
As a follow-up and part of the discussion, so what it sounds like then too is that because we actually formed it, then we didn't necessarily elect to opt in because of the formation. Therefore, we would not be able to opt out, but anybody else coming along later has the option of being in or out. Is that kind of?
I don't know that it's contemplated in the statute, frankly. I mean,
Okay.
Yeah. I'd love to get with John and talk about it because it's a little bit of a puzzle.
Okay, thank you. But like I said, I am not advocating that at all. So I don't want to be killed on whatever media that somebody wants to try to kill me.
He's already got the headline written.
Yeah, I can see it now. Councilman Casper. And by the way, that's spelled C-A-T-H-E-Y.
Spelling's on the website.
Okay.
I don't want my name mentioned, but here's how you spell it.
Well, I know it'll get in there. It's, yeah. Anyhow.
Do we have any other questions?
Thank you. I appreciate it, Eric. Thank you.
More, two comments, I would say. I do think that the mills issue should be explored further, and we should look at bringing them into the fold here. On the rest of, that kind of that breakdown, though, I mean, the lion's share are Casper residents by a lot, and I think we should remember that of the folks that are not, that's not all being subsidized just by City of Casper funding. That's also through fees, through grants, like a portion of those, and it's not all just coming out of our checkbook, a portion of those things are covered by the other ways that the health department gets money, so I don't, that figure doesn't, cause me too much concern, though I do think the mills situation should be considered. And the other thing that I would mention, I think this information is really helpful.
Yes.
It is, it gives us a good sense of how complicated this is, how many programs there are, how many balls are in the air at any given time to run a health department. And I think that we all should also remember that the reason this is statutorily mandated is because community health affects not just these people who go to the health department, it affects everybody else in the community who doesn't go to the health department, and that's why it is a function of government, because it's not just, if somebody has a communicable disease and is not treated, that can spread throughout the community, and so that's why we have government involved here. And I think that speaks a little bit to your point why it's not, we don't just leave this up to the private sector to handle this. It's a big task, keeping a community healthy. So I guess those are my only comments. They're not really specific towards any sort of direction, though I would say part of the direction in my mind would be we open a conversation with Mills, whoever the appropriate entity to open that conversation is. I think that should happen.
Councilman Hill.
Thank you. I wanted to thank you for doing this and putting the time in, because when you brought this to us last time, it was really difficult for me to jump on board. I couldn't get my mind wrapped around, and this is a much more thorough, the explanation is much better for me personally. I feel a lot better moving forward with this, so thank you for doing that. I know that had to be difficult for you, but it really helped me personally see kind of where we're at, and a community without a public health would be a really dangerous, bad thing. So I really appreciate you doing it. I know that had to be hard for you. So.
It was the 15 minutes versus the 30 minutes.
Well, thank you. So if it wasn't really that hard, then I'm giving you way too much credit.
It was very hard. It
But
took a lot of time.
I figured it did. So thank you so much for doing that.
Councilwoman Ingbridge.
Can you tell me what the number is to become a first-class city?
4,000.
So how close is Evansville?
They're like at 32. Bar none would probably be the next one.
Mm-hmm. Yeah, they're about close to the most.
Any other questions? All right, so we're moving forward on open to discussion as far as the number goes, and I know the question was, that's a question that wasn't answered. Question was asked also the county as far as their contribution. Do you know what that amount is?
We will be going and asking them for the same amount of funding that they we asked for last year.
That's the slice?
Yep. So we'll be asking them for 670,000.
Vice Mayor Pacheco.
I guess maybe we'll just start off with, just put Carter in the hot seat. I'll just pull one of those. Obviously, we know where we're at city-wise. That's where you get paid the big bucks, right? I guess kind of opening that up and seeing where we're at. I know financially we're trying to figure out lots of other stuff. I know we got a lot of things on the docket. And I know we're going into budget session next week to do those things. And so I guess, how do you, maybe to your council, what do you say?
Throw them right.
Well, I certainly expressed, Mr. Mayor, if I may, thank you. I certainly expressed reticence with regard to a jump of that kind of margin, wherein we've paid historically $540,000. It's kind of a trend line, if you will. Certainly, some years have been more, some years have been less. Without a doubt, that looks like a $110,000 request in terms of an increase. And my representation to you last week was that's hard to stomach. My opinion has not changed in that regard. That is hard to stomach still. Having gotten a much broader view of the budget since that time and so forth, you would have options to try to make that gap if you so desired. But I would still say that while the department certainly merits probably more than 540, which is where we've been, in the recent past, 650 to me is a lead.
Thank you.
Councilmember Pollock.
If I'm reading the funding history slide correctly, 22, it looks like as recently as 2016, we were in the $600,000 range. Does that seem right? And then we took quite a jump down in 17 and kind of hung there for a while and took again. Well, I guess that's, I don't know, fiscal year 2021. That one looks like a jump down as well, but if I'm reading this correctly, does that sound right?
Mr. Mayor, council member, I think we've had probably a $100,000 swing over the years, from as low as say 500 to as high as say 600. And I'm not sure if that's all inclusive of capital that we've participated in as well. I just couldn't tell you that, but it doesn't surprise me that there's a swing of that nature.
Councilman Cathy.
What I wanted to point out along those lines is 14 was probably the biggest year in decades, tax-wise, primarily because of the oil industry. At that time, oil was over $100 a barrel. There were 35 rigs running in the state. The economy was booming. In 15, that died. I mean, like, you drove up to a cliff and just fell off.
It was 16 into 15 is when that started.
It started at the end of 14. Because at the end of 14, we had 18 people out working, and by March of 15, we were down to 3. And if you look at the rig count, it dropped off almost that badly in the spring of 15. Now, there were projects that continued on, some of the facility build out and things, but even all of that tax money goes to where the end use is. So even if they were buying materials from, say, NOV here in Casper, but it was going into Converse County got all of that tax money. And that was when it actually dropped off, and we saw that result continue on in to 17 and 18. And so that's why you potentially see that big drop off in those funds, because basically we were losing the mineral revenue from the sales tax.
Councilman Nell.
Thank you. I want to go back to when you came and saw us, what was it, 2 or 3 weeks ago? And one of the things you said to us was, you've got this number here, and you could probably settle for this number, but you were going to ask us for this number because that's how you started a negotiation. You remember having that conversation?
Yep.
And at that time, we asked you to go back and really sharpen the pencil and decide what you really needed. And yet today, you're here with the same exact number that you brought last time.
Because I noticed we were able to evaluate how far we are cutting everything already. We will lose staff and we will lose programs if we continue.
But if I remember correctly, you also said that your staff had increased exponentially during COVID, which is now on its way back down. So it seems to me that you could probably use less staff. Is that not correct?
We have 47 staff members that are regular routine health department. The COVID employees are temporary. They go away as soon as the fund goes away. So there's 47 employees that run the health department doing all of the different programs that we run.
Councilmember Poplar.
Yeah, I was just, the challenge that we have is that public health cost is not correlated to the price of oil, unfortunately. So it puts us in a difficult position here, I think. It sounds like in some of these programs there are already not enough nurses to cover, in the maternal, what is it called, maternal child program. You would need 5 times as many nurses as you have right now to even meet what's statutorily required. And as I'm looking through this, almost every single one of these is state mandated. They're not it's not as if somebody just decided, somebody at the health department decided this would be a helpful program and stood it up. Vast majority of them we're required to provide to people. So, I just don't know where, we have responsibility to provide adequate funding for public health.
Well, I feel like we're tap dancing around the issue here, so here it is. It's $650,000 that's being asked. In my opinion, I guess the question, Carter, back to you would be, if we met, I'm gonna use the term halfway. I know that mathematically it's not gonna be halfway, but if we went to 600,000, and then I would like to look at, obviously it's a thing with mills, but I'd like to see that discussion take place, because if you're gonna step up to the table, you should pay your contribution to it. But can we do $600,000 this year? Because we're talking about next year's budget. We're not talking that we're locking ourselves in. I mean, we fluctuated for how many years? We're high, we're low, we're all over the board. But right now, it seems like it's needed to move forward to 600,000 for this next year and have that discussion with mills to potentially, not saying that they would have to be 50,000 or whatever, or maybe it would, but have that discussion with them to pick up the difference. Councilman Kelly, or well,
I'm asking for our city manager's opinion on that with my question.
Thank you, Mr. Mayor. Councilman Kathy, I think a compromise position is a great way to go. And while 600,000 is not anticipated in the budget that we have prepared in this section, that's not to say that we couldn't bring forward options for you to consider next week in terms of funding that delta. And so that would be, I guess, my response.
As a follow-up to that, what do you have in the budget right now for that item?
Mr. Mayor, if I may, Councilman Kathy, we have anticipated, not having gone through this conversation, mind you, a very reasonable $575,000. I know that Anna probably doesn't view that as all that reasonable, but nonetheless, that was what it felt like operationally could be done without having to look at other sources of funding to make this happen.
Thank you.
Councilmember Poplar.
I have a direction to propose, so I'll see what you think, but would it be possible that we have options presented to us during budgeting to target 600, and if we can find it, great. If we need to go adjust down from there once we see everything in front of us, so be it. But if we can start with at least a few ideas of how we might get there, that we can consider with the rest of the budgeting process.
Vice Mayor Pacheco.
Yeah, I think that's a great idea from Amber. I think my fear is, because I want to support as much as we can to the health department. That's been my stance. If we could do 650, I'd do it, but I know Carter would probably jump off a cliff. but I know we're going to have to make a compromise here, and I understand that, and so I'm ready to do those. But I also agree. My only fear is that we're going to have to look at where we're going to have to cut something, because I know that's how a budget works, right? So we're going to have to look at doing something. So I do want to see how we can make that work, because I'd like to get as much as we possibly can to the public health department.
So direction being given to the managers to come back to the budget with looking at 600 and see if we can do it. If we can't, then we adjust it from there.
And start talking to mills about the other 50.
And as an add-on to that, if you don't mind, Mr. Mayor, I would think at this point we could pass on to the health department that 575 would be the minimum. I would think 600 would be the maximum, so that they can kind of start trying to figure out what they're going to do as well.
Can we leave that open for the manager to, because I'd hate to lock him in the 575 and find out you can only do 550. Just saying.
He said he already had the 575 in the budget. That was why.
I'm just saying, if we leave it to him to be able to come back.
We're
with
only
options.
2 weeks from budget,
Yeah.
right? So, correct.
Next week.
Next week, not even two. Next week.
I mean, I would think that you guys can hang on and give us a week to kind of figure out where we're at.
We'll bring options, absolutely.
Yeah, next week's
No
budget.
problem.
Good?
Thank you.
Okay.
Thank you.
Thank you.
Thanks again.
Thanks for coming.
Such a depth
I feel like I'm getting sick. I may have to call in sick next Monday.
We'll do some Kyle back in.
But I think it'll only be a 3-day flu.
Monday, Tuesday.
Department of County, yeah.
You didn't bring us anything?
Okay, we'll move on to franchise agreement with Vast Broadband. Mr. City Manager.
Thank you, Mr. Mayor, members of the council. Much like we have done in recent, in the recent past, when we have a new franchise coming forward, even if it's a smaller one, or in this case where it's, you know, mid-sized, if you will, we want to bring to your attention that possibility, in that this agreement is something that impacts potential revenue. It's something that impacts access into your right-of-ways, and indeed also indicates some level of growth in local industry that hopefully you can feel good about. This is a company that is headquartered, I believe, out of South Dakota, and they have an interest in expanding their footprint into our community. And in so doing, I think will probably represent a competitive alternative for services of this nature in our community as well, which is, in my opinion, good also. If indeed they follow through with regard to what they anticipate doing, I think the access to broadband with regard to this franchisor coming into town is going to improve dramatically and be really good for the community. However, the bulk of what we wanted to talk to you about tonight was just to kind of give you a feel as to what the tenets of the agreement are, so that when you see it come forward on the floor, you'll understand what that's all about, and have the opportunity to kind of work through this prior to your formal consideration coming up here real soon. And just as a matter of interest, I guess, this is probably one of the quickest developments of a franchise agreement, particularly when it's brand new, that I've ever seen. These guys want to do business here. They're excited to come to town, and frankly, I'm excited to have them. And so with that, if I could, Mr. Mayor, defer to the city attorney to walk us through some of those principles of the agreement, I'd sure appreciate that.
Mr. Daniel?
Great, thank you, Mayor. Thank you, Carter. This really did happen quick. I mean, these people were on the ball. We worked with them very fast in my office, Mr. Trimback, and the thing, we used basically the same format for the franchise agreement that we would have with Bresnan. And to a large degree, this would be a competitor of Bresnan when they come in. They've looked at this, we've come up with it, and it's very similar, and it really needs to be similar because the FCC has a requirement that we have to give a level playing field to the competitors that are coming into our community. And so basically here, the amount of revenue that we would get would be the same amount that we would get out of Bresnan, and that would be 5% of their revenue, which is the maximum amount that we can get, and that would be commensurate with our amount that we receive from Bresnan. And in addition, though, where Bresnan gives us an EG station, Vast has now said, how about we provide you redundancy to your dispatch center, that 1 gigabyte upload, 1 gigabyte download. So that's a pretty decent thing. It would just be the backup system as opposed to a full-time system, but nevertheless, I know that's something the public service would like, and they've been looking at for a long time. So that's kind of the compromise that we have there between these things. The franchise agreement, again, would be for a 10-year period of time. We're looking basically now at trying to lock people in, letting them have a little bit of certainty. And I know, we talked about this a little bit last week. You guys are extending your term of office here. But realistically, with franchise agreements, it's nice for both the city, you have an ability to plan on revenue. With the companies, they know exactly where they stand with respect to the franchise agreement. And so we would ask you to consider that and go with the franchise agreement pretty much as proposed. And that will be coming up for your consideration if you give it a thumbs up here in the next couple of weeks. And Mr. Napier was correct that they've already now approached us that we have this negotiated. We're now looking at the easement agreements. They will be doing most of their cable laying by boring Mr. Beamer had asked them about that when we met with them, and just to make sure that that was going to be a large part of their efforts here to put in the cable.
Councilman Nell.
What, if any, downfalls does the city face by approving this?
You know, we will have, of course, some inconvenience. Probably you're going to have some more people, even if it's boring, you're going to have some intersections that are closed for periods of time, people wandering your streets, your public right-of-ways. But they will agree, and we have agreed and want them to pool share as much as possible, so we have as little new infrastructure as possible. And that would be, again, I think, good for the city and good for them. And really, the competitive advantages we view, at least in talking with them, that they would far outweigh any type of an inconvenience we would suffer. So we don't see really many. You know, if it were going to be a situation where there's only room for one, I guess you'd let the competitive markets determine that there will be just room for one of these types of services. But the fact of the matter is, we're growing. People are more and more demanding this type of service, and it probably doesn't hurt to have them pushing each other a little bit, because these people really are saying, hey, we're going to really push the speeds that you'll have and the broadband access that people will have, not only to businesses but also to residential areas, which I know that the President has been trying to push as well. So it'll be a good race, and I think that the citizens will be competitive winners.
Thank you.
Mr. City Manager.
Thank you, Mr. Mayor. I appreciate that question. I think in a lot of these circumstances, the real question becomes how much do you want your right-of-ways to be penetrated and so on. And I would say, with regard to exactly what Mr. Henley said, the benefits of having these kinds of services in our community, particularly in light of what we're hearing from our business people in the community, this type of service cannot be overdeveloped, in my opinion. And the only other thing I wanted to add is you will not see in this budget that we're bringing forward next week try to guesstimate and account for any revenue that this particular franchise would potentially bring to the table. You won't see those kinds of numbers until we know exactly what they're bringing to the table, and in fact have put forward by way of lineal feet in the ground and everything else. So we're not trying to bet on the come with regard to these guys coming to town. Just saying.
Councilwoman Ingrid.
I think my question was a little bit answered. I was just curious because you keep saying cable, but I think that they're laying fiber, are they not?
That's correct.
Yeah.
Councilmember Pop.
Private sector broadband enhancement. Easy peasy. Let's go.
Let's do it.
Well, it'll certainly help drive the prices down, maybe too. We'll see
Yeah,
competition.
it's great. Yep.
Okay, we good?
Thank you. Thank you. Thank you. Very exciting.
What's that?
So Ray likes monopolies, apparently.
Okay, tentative budget council, Mr. City Manager.
Thank you, Mr. Mayor, members of the council. The budget that you're about to receive tonight in no way should be considered your official budget delivery. This is a statutory stop we have to make along the way in terms of delivery to you and so forth. So this is very much a preliminary sort of deliverable that the statute requires us to provide. And so, you know, next week, in fact, this weekend, you're going to get the full document, which is a very thorough and hearty review of the numbers. And in conjunction with that, you'll also receive a budget narrative from myself that happens to be the longest I've ever written in my entire career. I don't know why that is, honestly. Yeah, you should be. It's riveting reading. So this does not include either of those. And so be aware of that. You're not expected to draw any types of conclusions with regard to what we're giving you tonight. Hopefully next week, however, that'll be a different story. So I just want to set that table and defer to Ms. Johnson if she has anything to add, if I could. Good.
Thank you. Thank you, Mr. City Mayor. I don't have anything to add. You covered that very nicely. Thank you.
No, sir. No, sir. Thank you.
Any questions from anybody?
No?
All right. Move on to agenda review. Mr. City Manager.
Thank you, Mr. Mayor. As was mentioned and promised, starting on Monday night, we have the budget review officially commencing. I suspect that most of the delivery will take place that evening. We do set aside the following Wednesday night as well, in case there are follow-up questions and homework and additional information that you need in terms of taking the informal review of the budget at this stage. And so you'll see on your agenda grid document that Wednesday night is also set aside for this purpose as well. I will tell you, given that many of you did not get to sit in on the Greg's presentation, which is the salary survey that we did, more than a year ago now, we've asked her to come back and give you a primer on that study. Even though I know you have it in hand and you've probably read through it and those kinds of things, you might find her review of that study, her primer of that, those results on the 19th to be beneficial. Certainly, if indeed council decides that's not all that beneficial, we can waive her off and save you the evening on Wednesday. In the middle of those two meetings, we have a regular council meeting scheduled. One of the items that we would like your guidance on is with respect to the pre-meeting topic, which would be the reinstitution of the downtown open container area that was put into law last year, if I remember correctly. And we kind of had an inaugural, tryout, if you will, of that concept last summer. So this would be our second run at this, and without a doubt, your direction in regards to those ordinance required kinds of directives from you would be very helpful. In addition to that, pardon me. In addition to that, you'll see a lot of continuation from things that you've talked about already, with the addition of a number of lease agreements that are coming forward pertaining to a number of recreational facilities that take on more of a model that you all have endorsed in the form of how we deal with Lansing, how we deal with Tanny, and so on. And I think that these agreements are much more beneficial with respect to the city and serving our clients more appropriately. Beyond that, I'm not sure that there's a whole lot in here that rises to the level of needing additional analysis at this point in time, unless there are questions that we can probably address.
Any questions? Councilwoman Ingrid.
What time are these meetings starting for budget session?
4:30.
4:30, yeah. It's a standard work session time.
Okay.
With the exception of Tuesday night. Tuesday night's a regular meeting time.
And then we get
Yes.
6 o'clock.
Councilman Kidd.
The rail trail expansion
No.
plan, that money coming from?
Mr. Mayor, Councilman, that is all MPO funded, and so that would not be a program that comes out of the operational dollars that the city has to work with, say through sales taxes or whatever.
Okay.
That was coming out of your account.
Do what?
That was coming out of your account.
If it's coming out of my account, you better cancel it right now. That's cutting into my Corvette money. No. No, that was what I was curious about. Thank you.
You betcha.
Anything else on agenda review? Legislative review? City Manager?
Mr. Mayor, I'm not sure that I have a whole lot to add. Interim committees are getting started, and without a doubt, we're seeing some pieces and parts of those conversations coming forward, and we're being given the opportunity to weigh in on a few things, which I really appreciate. And WHAM seems to be on the edge of those things, so I'm relatively comfortable that right now we're pretty good shape as it relates to something we don't expect coming forward happening. So we're kind of in autopilot right now.
Okay. All right, council around the table. Councilman Mel.
Oh boy. Well, let's start it off with a bang, because this is one of those situations where I'm probably not going to make any friends. But, in fact, I'll just wait to get to that. First, both Casper College soccer teams are currently nationally ranked. They're both in the top 25. And I bring this up just like I did with the basketball because the significance of our college doing well athletically means so much for the dollar. I know University of Sioux Falls, when they were recruiting my boy, when they won their national championship, their enrollment doubled. So I think we need to keep rallying behind our college and their athletes. The better they do, the better it is for the college and for our town overall. I had a question on a new business is coming to town. They're taking over a historical building downtown. And they called me today and asked me who they would talk to about how to go about doing the research and getting funding to preserve the building to its historical value, if you will, or recollection, I guess. And so I didn't know the answer to that, and I told them I would bring it up and see if I could get some guidance from somebody in that area.
Mr. Manager.
Mr. Mayor, Councilman, we could accomplish this in one of two ways. They could certainly call Liz's department in community development, and we can try to give them some ideas, or I can meet up with you after and we can reach out to them with the very right person to make that, you know, to extend a call to them, however you'd like us to do it.
Thank you.
You bet.
And then lastly, yeah, here it comes. So we had a letter in our packet from a woman concerning the DOJ money when it came to the marijuana stuff. And I have had so many emails, so many phone calls, and I've reached out to the 3 individuals on this council that voted no in receiving that money. I don't know what reason you voted for it, don't care. Here's what I do know. We took an oath when we accepted this position on this city council, and it's a 2-line oath. And it says, I will uphold the Wyoming Constitution and I will uphold the U.S. Constitution. Period. Now, whether you think marijuana should be legal or you don't think it should be legal is immaterial. It is illegal in the state of Wyoming to use, sell, consume, whatever, however you want to say it, marijuana. So I would ask you, instead of sending out mixed messages, if you can't follow the oath that you took to take this position, then you should probably relook at being on this council, because it is very clear why we're here and the only 2 rules we have to follow. And so for us to be asking for reports on what we did with DOJ money and how many busts were made and where that money went is not only a waste of resources, it's a waste of time, and it's completely inappropriate. It is illegal in the state of Wyoming, and we should not, as a city council, any of us, be advocating for anything different. You want it to be legal, go to the people that make the laws and get it changed. But our job is to follow the Constitution, and constitutionally it's illegal, and we should not be doing anything to the contrary as far as that's concerned. That's all I have.
Councilwoman Ingram.
I have nothing.
Councilman Cap.
I had received, and I don't know whether you did, Ray, or Mr. Mayor, about pigeons in the city, but I guess did you receive an email from a gentleman regarding that? Because he said he had sent one and got no response, but kind of, is there any kind of a...
In the city in general, or? I don't think I got that email.
It was on Sunday, is when I got it. But anyhow, it says, Casper Council ever addressed pigeon infestations throughout the entire city of Casper. Casper Council addressed it in 16 to clean up the mess downtown. Are bird infestations better addressed at the city or state level? How do we create an ordinance to address bird infestations? Which,
Pigeons.
that was kind of the the question that was posed. So that was one of the things, and we can discuss that later on, but that's, yeah, but that's what I was interested in. And then I did notice that the stop sign is gone, so thank you, folks. Oh, Andrew's gone, anyhow. Thank him for removing the stop sign. That's the stop sign east-west on First Street at Elm. So.
Elk. Yeah.
Do what?
Elk Street.
Elk, I'm sorry, yes. I said Elm, wrong street. Okay.
I think the chief still gives out permits for.
He's not giving them out. The guy from Sportsman said the chief will no longer, he doesn't want people shooting birds in the city. That's what he told us. So apparently the chief's not handing them out.
Guess we'll clarify that. He used to
Whoops,
hand
we
them
have.
Mayor Council, he's still handing them out, but it's based on a case-by-case basis, and some folks just don't meet his level of firearms expertise.
Oh, gotcha.
Some of the platforms they want to use are, are not approved within the city limits, so he's got a pretty egregious process you got to get through. Keeps everybody above board, so he's still getting those out there. Thank you.
Thank you.
Sorry, Shane, I forget your back.
Trying to be the gray man.
Councilman Johnson.
Just to answer, since I was one of the ones that voted no, it is not constitutionally illegal, it is statutorily illegal. And my oath to the Constitution is to the Constitution. And so sometimes laws can be unconstitutional, and there is a debate nationally and among the states on, does the government have the authority to regulate marijuana to begin with? Is there a constitutional provision, whether it's state or national? And so if you look at how marijuana became legalized, it started at a municipal level. It started in Denver. It worked its way up to the state of Colorado, same in California. It all started at municipal levels. And then worked its way up to the state. And now there's only 6 states left in the union that don't have any type of legalization laws. And so to me, it's trending that way. And my concern isn't necessarily that the DOJ funding was used to go against illicit cannabis. It's I have an issue with one of the biggest lawsuits that you'll find in municipalities and government are Fourth Amendment violations. And a lot of those stem from grant-funded police-type projects, right? A lot of that happens it stems from those types of grant projects. So I had questions on really the operations of how it went down, which is why I want to discuss it, not because of the marijuana issue necessarily. But no, I would wholeheartedly disagree with you that the law equals morality and that the laws are always constitutional, because they're not. I mean, for a long time in this country, it was illegal to be homeless in Casper at one time. It was illegal to be gay. It was illegal to marry someone of the opposite race. And so, no, the law isn't always right, and the law isn't always constitutional.
And
it's
I
not.
agree.
My oath is to the Constitution. I've taken that oath in the Army, the Sheriff's Office, and here several times throughout my life. And I will always fight to keep government where it belongs, which is on a short leash. And I will always fight for individual freedom and responsibility. And
Sorry,
so,
I'm having trouble.
sorry, Siri wants to weigh in on the conversation. So I will just disagree that I'm violating my oath because I voted against that funding, because that's not the same thing.
Well, if I could follow up, what I understood was, don't we have to, doesn't the, and I'd have to ask Mr. Henley, but doesn't our state have to change the constitutional, is it not a constitutional issue? It has to be passed at the state level in order to change it.
It's a statutory issue. It's not constitutional. It's a state statute. It's not a constitutional.
Is that the way you see it, John?
Yeah, the state constitution, the federal constitution, kind of the big concept ideas, and then below that, then you enact your legislation via branch of the government, legislative branch. And so at this point, it's still illegal under federal statute, but a lot of the state statutes have made exceptions to that. And so right now, the federal people have just decided not to enforce their statute with respect to those states that have amended it. So it's really not a constitutional issue. I think probably Council Member Johnson is right about that. It is a matter of state and federal statutes, and if they're going to be enforced or not.
And I think that's where a lot of the argument lies too, is the 10th Amendment. You know, does the federal government have the authority to create that kind of law, enforce it on the states? And the states have decided, well, we're going to stand up to the government, and so far they're winning. I mean, like he said, the federal government's is not enforcing any federal cannabis prohibition at all, which to me makes it even more confusing. Why is the federal government injecting money into Wyoming for that kind of thing, but you have states that just outright legalize it? I mean, if you really wanted to enforce federal cannabis prohibition, then you would be going after the states that have it fully legalized, in my opinion. So that's just
Councilman Gamble.
I wasn't going to say anything, but I didn't vote no against it. But I did, make a very public apology, regretting my vote for it. And it's an issue I'm pretty vocal about. Councilman Nell's concerns about upholding the Constitution and the oath. I've taken several of those questions from people questioning my stance on it, and so I just wanted to reiterate one of the replies that I gave them, and that is simply that, as Councilman Johnson said, laws do not equal morality, as Martin Luther King Jr. said, and unjust law is no law at all. I believe I am honoring my oath to uphold the Wyoming Constitution, because Article 1, Section 1 of the state constitution guarantees us all the inalienable and indefeasible right to alter, reform, or abolish our government in any such manner as we think proper. Article 1, Section 7 guarantees that no arbitrary power over the lives, liberty, and property of free men exists in a republic, not even in the largest majority. And I would be more than happy to speak more at length about why I believe our drug laws are arbitrary, but I believe they absolutely are. Article 1, Section 14 prevents the use of cruel and unusual punishment, which I believe incarceration is, in regards to, as a consequence of personal use and possession of drugs. And Article 1, Section 15 guarantees that the penal code shall be framed on the humane principles of reformation and prevention, which I believe it is currently not. So that's why I believe I am upholding the Constitution. I believe we strayed from the Constitution with the way that we are going about drug laws, and so that's my rationale for my stance. But other than that, I don't have any other things to say this evening. Thank you.
Councilmember Paul.
I didn't have anything tonight, but I have the luxury of following these two folks who have already covered most of my position on it as well. But I would just add that our oath does not. I think questioning my position on policy is valid, but questioning upholding my oath is invalid, and theirs as well, because the oath does not require that we allocate funds to those initiatives. It requires that we uphold the Constitution. So even if it did require that we uphold every single law that exists in the state of Wyoming, it doesn't dictate how we fund them and how we allocate funds. So I'm still not required by my oath to accept funds or individual projects or anything like that that speaks to any particular statute that we may or may not be addressing. So in terms of like a policy disagreement, like totally fair, happy to have that conversation anytime. But in terms of suggesting that I'm not upholding my oath, disagree on all of these accounts, plus the fact that this is a funding decision that is not dictated to me by my oath. So I'll say that.
Vice Mayor Pacheco.
Just a question for the Mr. City Manager. So I just had a question from a constituent. So we have online where we can report potholes, that kind of stuff. Yes, we do. I just want to make sure. Sorry, I'm just looking for some feedback. I'm a little discombobulated after all of this.
Mr. Mayor, Mr. Vice Mayor, I'm very grateful you didn't ask me about marijuana. Thank you. Thank you. So, yes.
Thank you so much. So, my question is that, so they said they put in the request about 3 or 4 weeks ago. How long does usually a request take if somebody does put in, saying they see some potholes, so forth? And so I just said I don't know, but I would find out, and then maybe even generally have a general conversation that people kind of have an idea.
Mr. Mayor, Mr. Vice Mayor, typically it's within 24 or 48 hours that those things are dealt with.
Okay.
So I'd be incredibly surprised if we hadn't, if we had received that and not dealt with it in a month. That
I will do a follow-up.
absolutely surprising.
Okay. Perfect.
But
I'll do a follow-up.
I'd sure want to be able to get a chance to fix it if indeed we did
Okay,
drop the ball.
let me do a follow-up on that.
Okay,
I'll get
thank you.
back.
Thank you.
The only other question I had is I'm looking forward to the budget sessions next week, although it's long and somewhat tedious to an extent. What I always am fascinated with, and I have been for almost the 8 years I've been on city council, is the work that the staff put in. It is incredibly intricate, incredibly professional, and it goes way beyond my scope and my talent. And so I am always the first person to sit and say they do a fantastic job putting it together, and you have just an amazing team. And so I look forward to seeing that again, and of course I'm being blown away with just, I don't know how you guys do it all, but it's very, you guys do a great job balancing the budget for us and all your hard work. So thank you guys, I appreciate it.
Councilman Kevin.
A very quick comment about your reference on the potholes.
Oh, yeah.
Wet weather.
Oh.
And also there is, I believe, a temperature limit as well. That it has to be above a certain temperature, because if the street is too cold, it will cure too quickly and it just all pops right back out. So with this odd weather to where we're running 20 degrees below average, would not surprise me if some of those pothole repairs are being delayed. So just a bit of knowledge that I kind of have from my previous life.
Yep. Thank you, Steve. Appreciate it.
You bet.
Only thing I gotta add tonight is, went to the health department meeting last week. There's, variance was put in on, variance request was put in on Monday for the school district. It sounded as though it was gonna be in front of, Alexia Harris by tomorrow, I think. And, same for all intents and purposes, that she was gonna approve that, so, so we'll see how it ends up, but the health department sounded like it was gonna happen, so. And CNFR tickets are on sale, so go get your tickets. Rodeo's on its way. Councilman Nell.
Yes, sir. I just want to, I want to be very clear that it's, I appreciate everybody here and the brains that I work with. I've said that 100 times. And there are going to be times that we don't agree on things. And this is going to be one of those. And whether it's constitutional or not, to me it's legal or non-legal, whatever it is, it's illegal. And I'll fight all the way to the ground trying to get money to keep combating that, because I don't want, personally, I don't want that stuff in our city. I don't want it here. You drive 2 hours and go do it all you want and be legal. I've seen the reports, we talked about it tonight, and some of the states that have legalized it and the problems that are coming with it. I personally don't want it. I don't have to worry about it because it's illegal. I'm sorry if I offended anybody. That was never my intent. And if we all thought alike, it'd be a damn boring place we live in. So please know that I came to you tonight respectfully as I could, because I didn't mean to be disrespectful to anybody. I just, it's something I'm very passionate about. I don't like this stuff, and I mean that's all there was to it. It's not personal, I promise. So.
Councilmember Pollock.
I wasn't offended.
Oh, thank you.
But again, that's a policy difference and a policy conversation.
Sure.
Like oath of office and like, are you or are you not upholding your oath of office? To me, that's like a dog whistle that's being passed around a lot right now on a number of these sort of controversial topics. And like, you think that, I don't think that's a violation of your oath of office. I disagree with gun policy. I don't think that's a violation of oath of office. So that's my only my disagreement with this sentiment. It's not, the policy discussion is like where I think we should, spend time, not whether you are not in violation of your oath for
well, and
policy
I was mistaken, and I'm glad you guys pointed that out. John made it very clear for me. It's not constitutional like I thought it was. So, complete mistake on my part there.
And if you were to believe me, it's the opposite.
Pardon me?
Or Councilman Johnson over here.
Right, it's something I'm passionate about too. And I mean, now if I was up here advocating that we ought to, adopt the Communist Manifesto in the state of Wyoming, and then you can accuse me of violating my oath of office.
Yeah.
That is, like she said, it's a policy argument. So
Sure.
That's all it is. As with most things in politics, policy arguments. I wouldn't accuse anybody of violating their oath of office just because they had a difference of opinion on it.
Well, and I certainly thought it was a policy violation, but the one thing you'll learn about me is when I'm wrong, I certainly have no problem saying I made a mistake there, which I did. And so I do apologize for that. That was not the avenue I was trying to take. I literally thought it was a violation of our oath. I thought it was a constitutional issue, and I have been stood corrected, and I apologize for that part of it.
So while we're on the subject of law-abiding citizens and whatnot, this week is National Police Week. I can't believe that I forgot that. So tomorrow, in front of the Hall of Justice, between 5:30 and 7, be a barbecue out there and
Basketball hoops.
And meet and greet and what? Slam dunk against Captain Channing here. So be there tomorrow. And when's the ceremony?
That'll be Saturday.
Down in Douglas.
Oh, that's Friday. The one in Douglas is Friday.
And we have one here on Saturday.
Not, I think it's 9 o'clock Saturday morning, wasn't it?
The one here, yes, sir.
Yes.
Okay. And if you want to go see the one in Douglas, it's on Friday. Had to Wyoming law enforcement. So, okay. So we up for tonight?
Thanks, Mayor.
Thanks.
Thanks, everybody.
Monday at 4:30, eh?
Yes.
Monday at 4.